A very big hello to all my dear students. How are you all? So, what are we going to study today? First of all, a very warm welcome to your favorite channel, You and I with Dr. Ruchi Rai. Which alphabet today? We'll be talking about G. So, can you guess what is this? G for? Yes, granular dystrophy, right? So, we are talking about granular stromal dystrophy. Granular stromal dystrophy, what are the points to remember? As you can see here, number one important thing, the deposits are looking like sugar granules and they are mainly hyaline deposits. Hyaline deposits. The area in between, that is the cornea, is clear. Okay, between the lesions we have a clear cornea, as you can see here, it is all clear. And this is how you differentiate when you talk about macular dystrophy. Between the two lesions, the cornea is hazy. Remember that. So, what are the other stromal dystrophies we know? So, we talk about granular, macular, lattice. Broadly, we talk about these three. Right. Okay. Now, granular, one additional point, can be a type 1 or type 2. When you say type 1 dystrophy, type 1 is also called classical and type 2 dystrophy is your called Avellino dystrophy. Avellino dystrophy is a combination of both lattice and granular. That means there is deposition of, I will write here, deposition of both hyaline and amyloid. It is deposition of both hyaline and amyloid. Okay. So, these are few points very important that you have to know regarding your granular. We will be solving one question here after a while. First of all, very quickly, I hope you know about corneal dystrophies. A quick recap here. I will just focus on what are the questions asked in this heading. So, when you talk about corneal dystrophy, ectatic dystrophy we have learnt is keratoconus. We are not taking that today. We are talking about, apart from that, we divide it layer wise, epithelial dystrophy, Bowman's membrane dystrophy, then we talk about stromal and endothelial. Very quickly, epithelial mainly we talk about microcystic, which is also called fingerprint dystrophy or mapped out dystrophy. What is the second one? Meesmann's. These two are epithelial. For Bowman's membrane, we have supposed to learn mainly about Reese-Buckler dystrophy, right? And then third, of course, Thiel-Behnke is another which involves the Bowman's membrane. Then we talk about stromal. In stromal, we have to talk about macular, granular, lattice. Now, we don't need to learn all the details. We should just know how to quickly solve these, just cover these topics. Focus mainly on what is asked in the exam. And then endothelial, you know, main important is Fuchs endothelial dystrophy. We can also talk about posterior polymorphous dystrophy. So, these are the different dystrophies layer wise. Now, I will just quickly revise with you the different questions asked under this topic and then of course, we will go to the question for granular dystrophy. So, very quickly, what is the most common corneal dystrophy overall? If I have all the dystrophies I have talked about and named in front of you, the most common corneal dystrophy you will answer is microcystic dystrophy. जिसको और क्या बुलाते हैं? We call it fingerprint or map dot dystrophy. Then they ask you what is the least common. These are all your exam questions. Okay. So, least common corneal dystrophy overall you should answer is macular. Then in macular we have two more questions, that which corneal dystrophy is associated with mucopolysaccharidosis. We answer it is macular. M for M, saccharidosis. Yeah, this is macular. Then another question they have asked you is that all these corneal dystrophies that we learn are autosomal dominant except macular, which is autosomal recessive. This too is your exam question, that this is autosomal recessive, right? Rest all are autosomal dominant. Remember this. Then what is the next question they have asked you is that which is most common stromal. If they ask you most common stromal, it is lattice type 1. Okay, type 1. If they ask you which corneal dystrophy is associated with amyloidosis, now you will answer it is lattice type 2. This is associated with amyloidosis, right? Okay. Yeah. And then we have one more question, that Reese-Buckler dystrophy involves which layer? I think this is simple. Reese-Buckler will mainly involve your Bowman's membrane. Okay. So, it involves Bowman's membrane. Majority of these dystrophies, majority are bilateral. okay, and of course it is genetic. Okay? Yeah. Which one is unilateral? Posterior polymorphous generally presents unilateral. Another question, corneal guttati is seen in, you will answer corneal guttati is a feature of Fuchs heterochromic, not Fuchs endothelial dystrophy. Fuchs endothelial dystrophy, right. So, these are your important questions regarding this. Now, coming to one question that we discuss every time, and this was your exam question. It's an INA-CT question only. Stain for the granular dystrophy, you should answer Mason trichome. We should also know what are the stains for your lattice. Lattice is amyloid. So, amyloid we will answer Congo red. And when you talk about mucopolysaccharidosis, that is for macula, we are going to answer colloidal iron or Alcian blue. Okay. So, these are some important exam questions related to corneal dystrophies, and this was about granular corneal dystrophy. Hope you enjoyed the session. Thank you so much. Stay blessed. Keep